Welcome to the Retzel Health Law Hotspot. Health Law Hotspot is a podcast for physicians and health professionals that covers the legal issues and trends that affect the healthcare industry.
Hi, everyone. Welcome to the Health Law Hotspot. I'm Ericka Adler, shareholder and leader of the healthcare practice of Retzel and Andrus. And today we're going to be talking with Rajesh Voddiraju, who I've known for quite a number of years. And Raj has been very involved as a healthcare entrepreneur for the past 25 years. Those listening may be familiar with his prior venture, which was Health Bypass. Am I saying it right? Health Bypass, which was a solution that helped redefine the patient revenue cycle and introduce things like cost transparency, convenience, and kind of a peace of mind for healthcare providers and consumers. He's now gone to the next level and started a new company called Stitch PEO, which I was really interested in talking to you about because Stitch PEO addresses what many healthcare practices are struggling with, which is how to stay independent or be independent, but still be able to handle HR challenges, benefit challenges, and other types of things that really are a struggle for independent practices. And one of the major reasons that they often choose to become employees or sell. So thank you for joining us today, Raj.
Yeah, great to be on this show with you, Ericka. Thank you again for all of your support over the years, and very excited to share some of our insights in terms of independent practices and what Stitch PEO can help them with.
Okay, perfect. So let's start with kind of what you've seen over the years in terms of the struggles that independent practices are having and some of the things that you've kind of devoted yourself to helping them with.
Yeah. So just for context, as you mentioned, I've been in healthcare for a long time. I come from a large family of physicians, have been an investor in a chain of urgent care clinics in the Chicagoland area through Health iPass, worked with many thousands of physicians, independent physicians in large group practice settings with 800 plus docs in a multi-specialty group, all the way to single specialty, 3-5 doc kind of single specialty group. So firsthand, I've kind of been watching what's happening with independent practices. As we all know, 2022, the last set of data that we have, 46% of all physicians now work in independent practice settings. And that used to be in the 60% about a decade ago. It was maybe in the 74-75% range back in the 80s, right? So I firmly believe independent practices are the backbone of the US healthcare system, and it is so important for all of us to do our little part in helping independent practices. And as you and all of your, your readers know and listeners know, Ericka, independent practices have a lot of challenges. Number one, of course, is reimbursement and falling reimbursements. Number two is wage inflation and cost inflation. And these two pressure points, unfortunately, create margin compression that begins to affect the psyche of the independent, practitioners to say, should I still remain independent? And across the board, the number one thing that we hear is staffing challenges, right? And as we talk to practices, they're looking for better ways to solve this issue of how do I manage my workforce? And we say people make the practice. You can do all the great things, and of course, being a physician is so rewarding. But ultimately, in service of your patients, if you don't take care of your employees, the practice is not going to continue to thrive. And so, like I said, our focus has been how do we get and help independent practices keep their employees happy? Because we know if it's happy employees, the patient experience will be incredible. So it'll be happier patients and therefore a thriving independent practice.
That makes a lot of sense. And I know, one of the things that my doctors, at least when I help them either sell or go become employees, is they don't have time to
Yeah.
play that role in their practice. They don't have the experience often to be experts at anything other than being a doctor. It
Yeah.
can be expensive sometimes to pay for that experience. And a lot of them, they don't have time. They just don't want the headache. And one of the top reasons that a lot of them will choose to sell or choose another route rather than staying independent is just the administrative hassle. And so they often they don't have that anymore when they sell, the private equity or the hospital or whoever it is. They have a whole team of people that handles that, right? So I'm also seeing a trend of, doctors who did sell or did become employees going back out to private practice now, and they're realizing how much they depended on those type of services. So I guess what I'm interested in hearing is, when they are looking to kind of fill these needs, how does Stitch speak to those needs? What does it offer? What can Stitch do that they may be struggling with?
Yeah. No, great question, Ericka. And as you know, any small business and any small practice, small to mid-sized practice, right? One of the big line items of expense is obviously wage, and closely following wages is benefits and the cost of benefits. And good benefits help you attract great talent. It helps you retain great talent. And if you're a 20 employee practice or a 50 employee practice or a 150 employee practice, unfortunately, you're only going to get a 20 employee rate in terms of premiums and the kind of plans that you can offer. And there is no easy way, and this is the realization that I had, that the only way to help these practices is to band them together to achieve greater economies of scale, so that it's no longer a 20 employee practice, it's part of a larger pool of employees. And luckily, as I have experienced in the high-tech space, the professional employer organization, the PEO, is a great model to aggregate lives without creating the onerous, potentially oversight of an MSO, if you will, right? Everybody is familiar with co-ops. Everybody is familiar with group purchasing organizations. So think of Stitch as a group purchasing organization for the sake of procuring the best employee benefits, and also to receive fractional HR services through certified professionals that can help you ensure that you have a good employee handbook that documents clearly what are compliant practices depending on where you're practicing, and making sure as part of the service that we are also taking care of all of your schedule management, time reporting, payroll administration, tax filings. All that back office, if you will, is essentially handled through Stitch as sort of that backbone for the practices. And no, you said it right? If I'm a practice administrator and also the physician administrator of a small group practice, I don't have the expertise to understand the ins and outs of payroll and schedule management. I don't have the HR expertise. Simple questions could turn into something that becomes a big storm, if you will, right? If it is not handled properly. And there are a number of areas from a potential liability standpoint. For example, it's so shocking to me how many independent practitioners, while they all get medical malpractice or professional liability insurance, Ericka, that they don't think about employment practices liability, right? And all docs, have a target on their back, if you will, right? All it takes is one bad apple in this unfortunately, sort of litigious world that we live in. And they're completely exposed in a lot of cases in terms of a liability like that, right? So workers' compensation, employment practices liability, professional liability, general liability for the practice itself. These are all areas that require very specialized and focused skills.
Okay.
And the typical practice administrator, they should be spending their time on patient acquisition. They should be spending time on the patient experience. They should be, masters at revenue cycle and making sure that they're getting paid and providing exceptional, clinical care for their patients. The administrivia can be handled by Stitch. Again, just creating economies of scale for lots of independent practices out there.
So if somebody signs up with Stitch, do they get everything, or do they choose what they want or what they need? How does that work?
Yeah, no, great question. So we have created a very, very customized offering that adapts to the practice and the specific needs of the practice. At the core is payroll as a service. So instead of, going to an ADP or a Paychex or what have you, they typically switch payroll over to Stitch. We, unlike the ADPs of the world, essentially take care of running the payroll on a day-to-day basis, but also do all of the tax filings with the respective authorities. Federal, state, and local government, taxes are all handled by Stitch. Because of this co-employment model, we also provide a set of, I'll call it the HR infrastructure. So making sure that you have a fully compliant employee handbook, state specific, embracing all of the policies that are the latest and greatest that are compliant with the local law, making sure that you've got the proper labor posters that you have to hang in each of your locations, so on and so forth, and a certified HR professional that is available both from a strategic advice on HR and talent acquisition, but also any question that may come up, any issue that may come up, any question an employee may have, setting up good professional management infrastructure, is what the HR, team effectively does. And a whole host of, both medical insurance, dental insurance, vision insurance, short-term and long-term disability, 401k, life insurance, and a whole host of benefits that have particular appeal to independent practices and workers that work in these settings. And every practice effectively chooses what benefits they want to offer. For some of the mid-size and larger practices, Ericka, we also have some advanced functionality. And again, they can pick and choose what makes the most sense for a particular practice at that particular point in time. And of course, the infrastructure is there within Stitch that they can grow into the things that they want to adopt at the appropriate time.
Oh, that sounds great. And have you gotten feedback at all about, what the switch over to Stitch PEO has resulted in terms of work hours, costs, etc.?
Yeah.
Just kind of curious.
Yeah. So, I can give you some specific data points. We've had practices with 100 plus employees to lots of practices that are in the 10 to 30 employee range. If they use a PEO like ADP Total Source or an Insperity or other companies like that, we've been able to provide great cost savings for them, both in terms of admin fee that is charged by these massive organizations that don't cater to the specific needs of a medical practice. Oftentimes they don't get the type of support and service that a company like Stitch can provide, focused 100% on independent practices. And we've curated some incredible health benefit plans, which is a big expense. And oftentimes there is a 30+% savings in terms of the total cost of health benefits while providing richer benefits at a better cost. That's certainly been a big part of the value prop. The second big area is a massive reduction in the administrative burden. If they're trying to piecemeal it together, have a hodgepodge of different vendors that they're doing, they can come to Stitch, and literally it's going to give them so much time back, both for the physician owners as well as to the administrators, so they can focus on patient acquisition, patient care, and building a practice and not worrying about trying to become HR professionals, and leaving all that to the Stitch team to help them with.
I think that sounds excellent. I mean, I know daily get calls from people with various questions related to that. Even when you're just terminating an employee, you need to remember to give the COBRA
Right.
notice. Need to remember to give their final paycheck, to terminate the benefits or roll over their 401k or whatever it is. And I think there's a lot of mistakes that happen when a lot of these smaller practices, their receptionist is their practice manager, is
Right.
their HR
Right.
person. So I
Right.
could totally see how that works. And there are a lot of issues that are very specific to healthcare that somebody who's running an architectural firm or a big company is just not going to be sensitive to. So I totally get that. Do you plan to expand the type of services that Stitch is going to offer? What do you see kind of going forward?
Yeah, no, great question. We are focused, like I said, 100% on independent healthcare groups and specifically medical practices, dental practices, and so on, Ericka. So providing a complete set of, while still customizable, a complete set of solutions that will help them take care of anything related to employees. So hiring people, onboarding people, training people, managing and helping with the effectiveness of their existing staff, both clinical and non-clinical. And the things that go into making employees happy. So benefits is obviously a big part, and not just health insurance. That's table stakes, right? We, for example, have a service that we call it the Life Concierge. It can help the high stressed employees, whether it's the physicians, the clinicians, the nurses, the front desk, whoever, with anything that they need, right? It could be, hey, I want to get an appointment for, getting my nails done, or I want an appointment for a plumber to come fix something, or I need to plan a family vacation and I need help, creating that. We've got a concierge service that helps employees that work in medical practices with what we call life stressors. And it
I could
can turn their to-do list into a ta-da list, if you will, right? That gets done. That's a very specific service that people don't think about how that can be so helpful to boost employee morale. And for a relatively inexpensive and low investment, they can offer that either as a benefit to all of their employees or for a certain class of employees as an executive benefit, for example. We provide credentialing and monitoring of their licenses, for example, as part of our platform. We've got compliance and healthcare 101 type of training that we offer, particularly as you mentioned, if they bring people from other industries on the non-clinical side, administrative, what have you, functions. These are examples of things that take off work from the practice administrator that's already stressed out and
Right.
has got a lot of things on their plate. And we will continue to expand into professional liability coverage, again, helping drive economies of scale and better pricing for all of the practices that become part of the Stitch umbrella.
Right. I think this sounds like an incredible idea. I know that you definitely had supportive investors as you build this up. And has it been well received by independent practices? Are they recognizing what
Yeah.
you
Yeah,
able?
no, it's been incredible in the very short period of time that we've launched this, Ericka. We've had the support of many practices in Chicago, in Illinois, in California, New York, New Jersey area, so on and so forth, which are the markets that we started in. Just the other day, we publicly announced the round of funding, as you mentioned, from an incredible investor called Redesign Health. We received 8.75 million in seed funding, which, as you know, is very, very unusual to have that level of funding. It's just a testament to the strength of the need in the market and the solution that we've kind of created for independent practices. We've also had the support of independent practice associations like the Independent Physicians and Providers of Illinois, IPPI, for example, that have embraced Stitch as a gold standard or a preferred, partnership across the 120 plus practices that are part of IPPI. And a lot of the IPAs of large health systems we are actually in conversations with, as well as several revenue cycle management companies, healthcare IT companies that see this as a tremendous value to offer to their clients. Yeah, it's just been phenomenal to see this reception from independent practices nationwide.
Yeah, I think it sounds like a great idea. I think you've really pinpointed, what independent practices are looking for. What will help keep them independent or help them go back to being independent, which is something, near and dear to my heart since I work with so many independent practices. I see them selling, right and left. And I know that, hopefully the future will make it a little bit easier for them to stay in practice privately rather than, continuing to sell. So any final thoughts you want to share?
Yeah, hello. Look, I've a lot of family members that are physicians, as I mentioned. Independent practices can be such a rewarding experience, and both financially as well as for them as practitioners. I didn't go to medical school. When they went to medical school, they don't get trained on all of the administrivia that they have to deal with, and that's the frustration that it causes. And we're very glad that we can, help independent practices band together ultimately to offer better benefits at a better price for their staff, and attracting and retaining staff in this very important part of the healthcare ecosystem, like you said, is very near and dear to my heart. And I'm so glad that we are seeing both the interest and reception from investors and clients and a number of channel partners alike. And I look forward to continuing this growth and continuing to invest on the things that will make independent practices thrive in our healthcare system.
I agree, absolutely. So what we're going to do is we're going to share your information and a link and some info about your Stitch PEO services when we post this. And if anybody has any questions, I welcome them to reach out to me or to Raj directly. And I'm sure there's so much more that you could say about what you guys are doing, but I really think this is an important service. I wanted my independent doctors that are out there, or those thinking that it's too overwhelming to start a practice or too overwhelming to go back to private practice, to know that there are some options out there that can really help them. So thanks so much for joining me. I appreciate it.
Yeah, thank you, Ericka. And our website is stitchpeo.com, and look forward to the opportunity to have any conversations with any of your followers and readers. Thank you so
Great.
much.
My pleasure. And thank you all for joining the Health Law Hotspot. You can see more of our podcasts at ralaw.com. Thanks for joining me.
The Retzel Health Law Hotspot is made available by the firm and its attorneys for educational purposes and to provide general information, not to provide specific legal advice. Use of the Retzel Health Law Hotspot does not create an attorney-client relationship between you and the firm or any of its attorneys. The Retzel Health Law Hotspot should not be used as a substitute for competent legal advice, and you should contact an attorney in your state about any legal needs or questions you may have.